Hey, what's up, guys? This is Dr. Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. Now, a lot of my patients have been asking me about apple cider vinegar and whether or not this is something that can truly help with their blood pressure, their diabetes, and their weight. So in this video, I'm going to give my thoughts on apple cider vinegar in terms of the benefits and the potential harms. Apple cider vinegar is one of the hot topics in health and nutrition right now because many people believe that apple cider vinegar can help lower their weight and their body fat, decrease their blood pressure, and also lower their blood sugars. And a lot of this comes out of some scientific experiments that have shown that it has the ability to lower these parameters. Specifically, it has been shown to decrease bad cholesterol, increase good cholesterol, lower blood sugar, satisfy hunger quicker, lower the levels of renin, which is a hormone responsible for increasing blood pressure, kill certain groups of fungus, and be an antioxidant, meaning that it can tone down the high stress processes that take place in the cell. But if you look closely, you will see that there's one big issue with all these studies. All of them were performed in either test tubes, mice, or rats. I was able to find one randomized controlled trial involving Japanese subjects published 10 years ago that was performed in humans showing that fat composition, body weight, and triglycerides can be reduced. But it only involved 175 subjects and used acetic acid, not apple cider vinegar specifically. Now, having said all that, just because it hasn't been proven yet scientifically in humans doesn't mean that it could not be the case in humans. But you do have to be careful in terms of applying what you see in animal studies to what is true in us. Now, my personal experience with my patients has been that whenever a patient has signs or symptoms of high blood pressure, either due to running out of medications or just not being compliant with their medications, and they report taking a spoonful of apple cider vinegar, they report that their symptoms do go away. However, a lot of those times they didn't really actually check their blood pressure. They just kind of assumed that it was high. So in a lot of these cases, we can't really be sure whether or not the apple cider vinegar truly did do anything in terms of lowering their blood pressure. And also in a lot of the cases where maybe they did check it and it does seem to go down, it seemed to have had just a temporary effect because they're still sitting in front of me in the office with an elevated blood pressure most of the time. I think that it's possible that apple cider vinegar could lower blood pressure, blood sugar, cholesterol, and help you lose weight. And even if it doesn't, it doesn't really appear to have any major harmful effects if it's taken in moderate amounts. But before you start taking apple cider vinegar, you should discuss it with your doctor because it does have the potential to interact with certain blood pressure and diabetes medications. The main ones to know about are diuretics. Examples of this are hydrochlorothiazide, chlorthalidone, and furosemide, also known as Lasix. This is because apple cider vinegar lowers your potassium just like these medications do, so it can lead to a dangerously low potassium level in the blood. Another medication that you should be careful with is digoxin. This is a medication that's often used for people with heart problems. When potassium is lowered by apple cider vinegar, this can cause the levels of this medication to become dangerously high in the body, increasing the risk of complications and side effects. The other medication to be careful with is insulin because the theoretical decrease in blood sugars that apple cider vinegar can lead to, taking it with insulin may have an unpredictable effect on blood sugars and in some cases cause too low of a blood sugar. Now, if you're young and healthy, or if you're somebody who's on a borderline in terms of some of these conditions and haven't been officially placed on medications yet, it might not necessarily hurt to try apple cider vinegar, but there are a few things to keep in mind. First of all, try not to buy into these sensational claims that people have of taking apple cider vinegar for just a few weeks and all of a sudden getting all chiseled. It's human nature to want a quick and easy fix to a lot of our health problems, but usually it's not that simple. And nothing at the end of the day really replaces a healthy lifestyle in regards to diet, exercise, and the avoidance of substance abuse. Also, if you've been diagnosed with a serious condition such as high blood pressure, diabetes, or high cholesterol, it's important to be compliant with the medications that are prescribed by your doctor because even if apple cider vinegar does have a modest effect on some of these conditions, it's never meant to replace any of these medications. Nobody really knows the true amount of apple cider vinegar that you should take every day, but the general consensus among some experts appears to be that 3 teaspoons a day is a pretty good amount. So add a teaspoon to your smoothie, drizzle a teaspoon on your salad, mix it in water if you want to drink it. but avoid taking it straight because frequent contact with your teeth can erode the enamel. Also, if you have heartburn or acid reflux, just remember that vinegar is acetic acid, so it's very acidic and it potentially could make the symptoms worse. If you're diabetic and have a condition called diabetic gastroparesis, which is a condition in which the gut is slowed down, then you might want to think twice before taking apple cider vinegar as well because of the effects that it has been known to have on the emptying of food from the stomach. If you're pregnant or breastfeeding, we have no clue whether or not it's safe for you to take it, so it's not really worth the risk. Just stick to your prenatals and your other medications deemed safe by your OBGYN. At the end of the day, it's clear that we still need more information from clinical trials and studies performed on humans to know whether or not apple cider vinegar truly is safe and effective. And I don't know about you, but I'm definitely going to stay posted because as a primary care physician, I'm always looking for new ways to treat these common medical conditions without having to resort to medications. If you have any questions or comments, please drop them down below, and remember to subscribe to Trust PCP for breakdowns on other medical topics. Thanks for watching, and peace out.